Hi everyone, my name is Camellia. I am a psychiatric mental health nurse practitioner. I'm also known as a PMHNP. I'm also a nursing and mental health enthusiast. And I just wanted to pick up on the series that I've been doing on performing a psychiatric interview. I've done, I think this is video 5 or 6. I've done a video on just sort of the introduction when you are performing a psychiatric interview with the patient. We've talked about obtaining the patient's psychiatric history, family history, medical history, social history, and now I want to sort of kind of land on the more present and some of the things that you will discuss with the patient about what's going on with them actively. And so this is where I start from getting more information about kind of what's going on with them now. This is the here and now. So we've talked a lot about history. Now we're kind of at what's going on now. And so today's topic is actually about substance abuse. And I do get very direct with patients about this area of the interview, and that's because it's important. So what can substance abuse tell you? It can tell you how a patient is coping potentially. It can also tell you if there is anything that may be interfering with what you are seeing. For example, things like psychosis, things like mania. If a patient has recently done any form of a substance, sometimes we see those things more presently. And so it's very important that you get specific information here. So I usually start this part of the interview by asking patients, has there been any substance abuse, any substance use, anything you've used to either cope or that you've used recreationally? It's important to know their history with that. It's also important to know what they possibly are doing now. If patients tell you that they are doing a specific substance, I will get very specific and get more information about how often, when was the last time you did this, and how often do you do it weekly. And so it gives you some indication for whether it's active substance use or past substance use, and also kind of the acuity of the situation. You are also going to specify, and I usually get very specific with patients, and say any alcohol use. I will get, because a lot of times patients don't think about alcohol and marijuana for some reason as substances. So I do clarify and get really specific about alcohol use. When was your last drink? How often are you drinking? How much do you drink in one sitting? Those are specific questions for each substance that you want to ask. I also ask questions about marijuana use. It really depends on your geographical location as to, whether this has been legalized. But I will tell you that, this is important because a lot of patients don't consider marijuana as a real substance. And so why is that important for us is because we can see things like psychosis. We can see things like severe anxiety and panic attacks specifically with marijuana use if there is a high concentration of THC. A lot of times patients don't know what they've consumed. They don't have any idea of the concentrations of things, especially if they're getting it sort of off of a street. So you have to really be careful and specify with patients about these things. I also ask patients, why, I tell them why it's important. This is important for us because it's going to help to guide your treatment plan. I get very direct again here, but also I've found that most patients are pretty honest about this because many of them, once they come to you, unless they are coming because they've been forced to do so by programs or other things, many of them they want the support. So you may also be using screening tools here, things like the CAGE screening for alcohol use. That will give you more specific information as well about how severe the alcohol use may be. But you really want to get specific and direct with patients during this part of the interview. Also, if you have any concerns about, the fact that someone may not be telling you everything, you can always do a PMP search, which is basically a controlled substance database. Why is that important? It's going to offer you a couple of things. The first thing is if a patient has had things like an opiate use disorder and they've been prescribed Suboxone, they are going to have that listed on the registry. Okay, so that'll be important information. It's also going to be important for you to know about substance abuse because it will guide your treatment plan, not just from what they're doing, but also potentially what you want to be cautious with what you're prescribing. So for example, if a patient has a substance abuse history, then you may be more cautious with prescribing things like controlled substances, whether that's a benzodiazepine or things like Adderall for ADHD. You really want to get the big picture so that you are really doing the best for the patient. And I get very direct and honest with patients about this as well, because there is sometimes a history of abuse or dependency or addiction. Then we don't want to set you up for that at this point. So things like the nature of things like benzodiazepines, such as clonazepam or lorazepam or Xanax, we want to be very cautious with that so that we don't set you up for that going forward. I also, just as a rule of thumb, if a patient does not come to me on a controlled substance, I never prescribe it on the first visit. And that's just because we have to be cautious. We also want to be sure that patients understand that we can't have controlled substances as a maintenance medication. And so many times that helps us to steer away from any dependency as well. So just be very specific with patients here. Again, substance abuse is going to tell you how are they coping and is there anything else that could be leading to their present symptoms. That's where I want to land on this. This is a very short video. It's really just designed to chunk information as we kind of get to the more here and now, the active things that are going on with the patient. But this is a very key part of your interview, and it can be very telling and give you lots of information that will help to direct your treatment plan. If you guys have other things that you have considered that you've had to come up that you found useful, please feel free to share that here on this platform. I'm not only a person who's trying to share information from my perspective. I am not all knowing, but I'm very interested in getting information from you guys as well so that we can all learn together here. So please share any comments, questions that you have, and I look forward to continuing the series, nearing the end of the series in the next video. Thank you.